One of my Winchester, Virginia patients came in about 8 weeks ago after delivering her fourth child. She'd undergone the Venefit procedure, used to be known as venous closure, a few years ago, and had wonderful results and beautiful legs. Since the second trimester of this most recent pregnancy, she'd noted lower leg varicose veins and some symptoms of aching and tiredness in both legs, especially when she was standing. She highlights one of the known predisposing factors to the development of varicose veins, which is multiple pregnancies. The elevated estrogen and progesterone hormones during gestation causes the vein walls to expand, and as they expand, they get relaxed, and then the veins themselves become engorged and can cause the surface varicosities that women often notice. This sometimes gets better postpartum, but the vein damage persists, and there's usually some degree of discomfort after delivery. So women should be aware that the blood clot risk also increases with the pregnancy, especially with those with pre-existing varicose veins. Leg tenderness and swelling should not be ignored because these are typical signs of blood clots, and an ultrasound is very helpful in assessing the venous system. Support hose can often reduce the symptoms, but it doesn't always cure the internal underlying valve problems. So naturally, we don't intervene during the pregnancy because this is considered a more risky thing to do, but we do recommend support hose and leg elevation as much as possible. Exercise is also a good thing to pursue. At Capital Vein and Laser, we are very adept and experienced in evaluating women with this kind of condition, and we think usually a month or two postpartum is a good time to come in to see either Dr. McNeil or myself, and we'll do the venous ultrasound exam, do a full examination, and then give you the best advice as far as treatment is concerned. You ought to know that venous disease is very easily treated. Some women tend to have recurrent symptoms even after very successful treatment, and this can be more related to heredity and multiple pregnancies. But the treatments these days are done in the office under local anesthetic. You can have immediate return to normal activities, taking care of your kids, and even going to work the same day. Driving and walking stairs is perfectly fine, and insurance does cover these treatments.